Hello, everybody. Getting ready to start talking about some autoimmunity. So, who has autoimmunity right now? Anybody dealing with autoimmunity? Um, we've got some Hashimoto's, rheumatoid arthritis, lupus. What are we dealing with autoimmunity, and what are we doing about it? So, if you have autoimmunity, what's your plan? Do you have a diagnosis? That's a little bit tricky. Sometimes it takes up to 10 years to get a proper diagnosis for autoimmunity. I don't know if you have gotten diagnosed, if you're in the process of trying to get diagnosed, if you know what you have, and if you have some strategies around what you're doing about your autoimmunity. So, I am I'm a functional medicine practitioner, but I specialize in autoimmunity because I have an autoimmune marker and so does my daughter. So there's nothing like having your daughter have an autoimmune marker to make you know everything about autoimmunity. So I'm here to answer your questions, but also ask you some questions about what you know about your own autoimmunity. Do you know if you have a proper diagnosis? A lot of my patients don't know they have autoimmunity until we actually do the testing. So let's talk about that testing. So, if you have a low thyroid, have you been checked for Hashimoto's? Because most people that have autoimmunity have low thyroid actually have Hashimoto's. So it's important for you to know what you have so we know how to manage it. Okay. So, because if you have thyroid autoimmunity, and you don't know if you have Hashimoto's, you could be driving it by eating gluten and dairy. You need to be having some vitamin D. You need to be taking some immune system modulators, right? Some things that will calm your immune system down so that we can make sure that you can keep your immune system at bay. So there's that. And also, if you have joint pain, if you have fatigue, if you have rashes, if you have a positive ANA, this is where it gets really tricky. So, positive ANA opens you up to a whole world of possibilities of what could be positive, which could be lupus and rheumatoid arthritis. It could be Sjogren's. It could be autoimmune ANA markers that just mean you have inflammation. So, like if you have an autoimmune marker that's dense, fine speckled, that can mean, gosh, you've had a virus, you're inflamed, your body's under stress, things are not going right for you. Okay, but now what? Right? So that's a tricky thing when you don't know what you have. So some of you have a proper diagnosis and you're taking medications and then need some guidance around what else you need to be doing. Like, what are the functional medicine strategies that we need to braid into your life to try to get your immune system to actually shift and calm down and feel better? So, I have so much to say about this because I see people come in with leaky gut and that triggered their autoimmunity. They had COVID and had autoimmunity. They had a COVID vaccine and they got autoimmunity. Their mom has autoimmunity or their sister does. So it seems to run in the family, right? Up to, listen, I had a baby and I developed autoimmunity, or I had a really, really stressful event. So that can really, I mean, it's really so there's so many possibilities of what can happen when you have autoimmunity. My first question is, what do you feel about how do you feel like this happened for you, right? Um, so that's we really want to make sure we know why you feel like this happened. Do you feel like you were fine and then one day you weren't fine? Did you feel like gosh, I've had these pains since I was a little kid, right? So maybe nobody tested you because you were little and they didn't know. So sometimes what will happen too is a lot of my women that I see, they had a baby or they got really, really stressed. They didn't sleep for a long period of time, or they went into menopause. So menopause can be a big trigger for autoimmunity because when we have estrogen on board, it's an anti-inflammatory, right? So we're just kind of figure out like what's going on, right? Like, why do you have this? Sorry, I'm gonna have to block someone that's being weird. So, we want to know what the history is, right? As somebody who has lupus at age 50, yeah. Do you feel like you had it earlier? Do you feel like you developed it a while ago, or do you feel like it was during some sort of period of time? Because that's what I'd love to understand. I'm happy you've been diagnosed properly with lupus, because I find a lot of my I have a lot of my patients that can't get diagnosed properly, and this is really, really tricky. So can ARFID lead to severe stomach issues? This is where you can't eat a lot of particular foods. Your son eats Cheetos going on 3 years straight. Wow. Yes, it can. Yes, it can. You can have a lot of gut lining issues that get really inflamed, and you can develop a little bit of leaky gut, and it can contribute to the ARFID situation. So yeah, for sure. It'd be great to try some things. Maybe see if he can chew on some deglycerized licorice, some slippery elm, marshmallow root. These are things that are really soothing for the gut lining. That can be helpful. Someone's wife was diagnosed with Lyme recently. Yeah, okay, Lyme. Woo, what a rocket ride, right? You're like, okay, where are we? So the tricky thing about Lyme is that you get there's all these sort of like co-infections that can happen, and then you have all these co-infections can be like stuck under like these biofilms that can be stuck in your body, and your body can't get rid of it. So your immune system might not be able to see it, right? So that's tricky. I hope you have like a Lyme literate doctor that you're working with, because you really need someone who knows what they're doing. Sometimes this has to be a prescription medication for a while, like an antibiotic for a while, like a doxycycline or something like that. You can do different things to help break biofilms, and acetylcysteine, things like that can help break these biofilms, so your immune system can get at it, right? Someone says, oh, you had about 40, you had a scleroderma positive test, and then Lyme disease later. Okay. And then you have lupus now. So here's the tricky thing about autoimmunity is, then you live under an umbrella of autoimmunity. So you could have different autoimmune things that develop, like you can get into like all of a sudden you have NA positive that's for Sjogren's. You can get it for all of a sudden it's lupus, it's scleroderma, right? These are it's like almost like a moving target, right? So you have all these tricky things where you have to figure out, and the immune system changes. It's not going to stay the same. So when your immune system is rolling and attacking you, it can be really easy to kind of turn and attack another tissue. Okay. So it's like, oh, I'm going to do my thyroid, and then I'm going to do this joint over here. That's not a big reach, right? That's something can happen. What state am I in? You need some help. Okay. I'm in California. But listen, I just created this really cool new platform, and it's an online course that it's all self-paced. You learn 13 different videos from me. You learn a lot about the basics of autoimmunity, and I've developed an autoimmune support group and resources. So what labs should you get? What supplements should you get? Links to the supplements. It's a huge pile of resources. Go to my bio and just click in. It's called the Autoimmune Shift, or you can look at darlabooth.com and it says online courses. So pop in there, or, I do one-on-ones if you need some help. Somebody says mold toxicity, now suffering with heart flutters, skip beats, black curtain, corner vision. Okay. So you have some brain stuff happening here. So are you out of the moldy situation? We got to get you out, right? You can't live in it. It's hard to clean it out because you've already developed probably some immune system. The immune system has said, this is toxic. It's revved up. It can trigger autoimmunity too. So hopefully you're out of that environment. I would think about putting you on a brain anti-inflammatory. There's a very cool supplement that's called Neuroflam. It's by Apex. And it's all these flavonoids, like, the vitamin C with bioflavonoids. It's all these flavonoids, turmeric, rutin, apigenin, luteolin, all those kinds of things, crosses the blood-brain barrier, gets into the brain. And it's an anti-inflammatory inside the brain. So get some Neuroflam, take 4 to 6 of them a day. You could get on some turmeric. I would do a DHA fish oil and really help with your brain with the inflammation. Sorry, I'm going to sneeze. So that would be really helpful. Sorry. So that would be helpful for your brain. Your brain has been affected by mold. So we need to calm the inflammation down in the brain. And then we need to make sure that the mold is gone and that you can slowly work through getting rid of the mold. Gosh, so many things, right? So we also have heart stuff, SVT, AFib. Sure. So, how much is the program? So it's $179 to take the course. It's $50 a month if you want to be part of the autoimmune support group every month. And then you have access to tons of resources. So pop on there. And if you want to join me, we meet on Fridays at 11 a.m. Pacific for an hour. I lead the group. So great. And you can get your questions answered and get some support. So this heart stuff too is tricky because your heart rhythm can go crazy because you are exposed to mold or toxins. It can be go crazy because you're exposed to foods that could be triggered for you. So gluten and dairy are the top 1 and 2 triggered foods that are problematic for people with autoimmunity. So take a look at maybe figuring out your food situation too. Someone says I've moved, but have been exposed since I'm in a new house environment and not sure anymore. Okay, good plan. You're out of the house. Amazing. Perfect. That's what you want. Things that you want to think about. There's a really cool test you can take. It's called My Myco Lab, my MYCO, My Myco Lab. If you want something like that to see what's actually present, you can kind of it's a urine test. And you can really see what mold is still there. That might be helpful for you. There's some ways to kind of like get rid of it, but your body's detoxing it right now, whether you know it or not, because you're out of the environment. You can get on a little bit of glutathione that can help like kind of drip, get rid of it. You have to go really slow with mold. If you dump a bunch of mold in your system, you're going to get really sick. So you just have to go slow with this. Okay. And hopefully you have a functional medicine person who can support you. Let me know if I need to help and if I can help. But you can really change this. Don't worry. You can change. Okay. Cardizem has so many drug reactions. Yeah, that is true. So be interesting to know what the driver of that heart flutter, AFib and all that kind of stuff is. This person has all the signs of lupus. Doctor won't refer you, so I scheduled a Quest autoimmune test. Yes, good. Okay. Now, Quest is doing cash labs. We love that for them. It's so helpful. So let's talk about lupus. Now, you want to do a test called ENA, extractable nuclear antigen. So ENA, yes. So that's going to tell you specifically if you have lupus or not. You can also do a test that's called the ANA cascade. I'm trying to think about what Quest calls it. I do think it's called the ANA cascade. And that will tell you different tissues that could be involved. If it's Sjogren's, if it's lupus, it gives you more of a clue. Now, sometimes you do these tests and it shows up nothing. It's like, I'm ANA positive, but the specific tissues are negative. Great. So it just tells me you're loading this, right? You're developing this. You're like in the middle of the developing of this. So we want to get in the middle of that and disrupt it. We want to get you on some supplements to try to calm your immune system down. We want to figure out what your triggers are. We want to correct them. We want to change your diet. We want to just change the whole game because you can get in the middle of this and really stop the progression. So that's what I'm working on with patients is just trying to stop the progression and trying to calm this down. Why are you triggered? Can we figure that out? Can we calm it down? Yes. We can often calm it down. Now, if you have full-blown lupus, we have to now work with strategies to kind of keep your immune system chill. And like if you get the flu, oh my gosh, you're going to have a whole lupus flare about it, right? Because your immune system is overactivated. So we need to know these things, right? This is why I've made this autoimmune shift program for you to learn so much. It's like a little course, 13 videos, autoimmune support group, resources, so that you can know what you're doing and you can kind of go into your doctor and go, these are the labs I want. This is what I know what my labs mean. Here's how I get off of gluten, all these things, right? You need resources. You need a plan on how to turn this around. And that's why I've made this whole program because there's so much to talk about. It's hard to put it all in like a post or something because not everybody has the same thing. So, and had a 27 minutes of CT scan after a fall off a ladder. I'm scared of radiation. Okay. So what I want you to think about anytime that you get exposed to chemicals, radiation, something where you're like, this isn't great for my health, I'm a little worried about this, I want you to go out and get some glutathione. Glutathione. If you need a link for a supplement, let me know. Give me your name and your email and I'll send it to you. And you can order it for yourself and you take some every day. And what that does is it's an antioxidant. It helps to bind up all the stuff that's there. It helps to take it through the liver and it helps to detox it. Okay. You can detoxify these things. We just have to know what to do. Okay. So if you need some help, if you have a supplement store or like a health food store around you, go there, right? And just get glutathione. If you can get a liquid glutathione, even better. If you can get AC glutathione, it's a capsule, it's pretty good too. So that would be good. Can you have autoimmune disease but have a negative ANA? Yes, you can. So they call that seronegative, SERO, seronegative. And it's kind of this tricky thing. It's like almost like a diagnosis of exclusion, right? Like, well, the markers are negative, but you have a rash and you have joint pain and you have, things that you feel exhausted, and then you can get diagnosed, but then it's very generic. It might be mixed connective tissue disease. I mean, your joints are affected, right? They might call it fibromyalgia. They might call it a lot of like general things, but yes, you can have that. There are tests you can get done that might get more specific, which we could maybe investigate. That's helpful too. But yeah, you sure can. What else? Hold on. I got to block somebody because seriously, stop, grow up. Anyway, we have serious stuff to talk about here. I have a high white cells, swollen lymph nodes, chronic fever. Okay. If you have high white cells, you have an active infection. Period. The end. You have an active infection happening. Now, I'd be interested when you look at do you have your CBC there? Complete blood count, right? It's a changeable thing. It changes every day because your body's actively trying to fight this infection, right? I would like for you to look at where it breaks down. It says lymphocytes. It says neutrophils. It says eosinophils. It says those types of things, right? So what you're looking at is you're looking for neutrophils. That tells that you're more likely fighting bacteria. And then you can look at lymphocytes. If that's high, you're more likely fighting a virus. But that's serious stuff. When I see a high white cell and a chronic fever and lymph nodes, I mean, if you have high white cells, you might need to get on an antibiotic. I mean, I wouldn't mess around with it. You could, if this is a remitting up and down thing, we got to get to the bottom of what is driving your immune system like that. Okay. So things to think about. How do you treat cholesterol besides statins? Oh my goodness, this is a tricky one, isn't it? So, okay, first thing I want you to think about, I want you to look at your cholesterol panel, and I want you to tell me what your triglycerides look like. Okay, so your triglycerides are going to be telling me if your cholesterol is being driven up by high sugar and high carb diet and high blood sugar, like hemoglobin A1C and fasting blood sugar and that kind of stuff. I want your triglycerides to be under 100. So if it's under 100 and you still have high cholesterol, it gets a little trickier. I've not had great success with red yeast rice, niacin. Sometimes I have some of my patients will do a sauna cold plunge 4 times a week, and it really lowers their cholesterol. I think I don't know, it calms down your liver. I'm not really sure what it's doing, but it's working pretty well for some of my patients that have really resistant high cholesterol that don't want to go on statins. So look at your triglycerides. Okay. Okay. Hey, Gwen's here. Hi, Gwen. Gwen, I'm doing 90 days of lives. I'm going to be here every day. I'm telling you. What if I run out of things to say? I won't. Okay. Hold on. I'm just trying to see. Okay. So someone has a bad rash and very tired, and you have positive ANA. So fatigue, joint pain, rashes. Those are kind of the triad that we see that implicates a lot of autoimmunity. So I want you to and if you can get an ANA cascade, that's a very helpful test, because then you can see what markers could be positive besides just ANA. It gives you more tissues that it's going to check and see if you have dry mouth or dry eyes. It's going to give you lupus markers. It's going to give you all these sorts of different, like, is it affecting your liver? It's all those things. Okay. So take a look and see if you can do that. Intermittent fasting and consuming whole foods definitely helps me. Okay, intermittent fasting. So is your trigger high blood sugar? Because if intermittent fasting helps you and lowering your blood sugar can help you, maybe that might be one of your triggers. High blood sugar and low blood sugar can be big triggers to get your immune system really upset. So that's something you can do. So someone's diagnosed, but yeah, lupus 2 years ago. I keep getting negative results in my blood test. Okay, interesting. So here's the lesson of all the lessons is the immune system is changeable and it can change. And this is what we're banking on through my autoimmune shift program is I'm banking that I can get a lot of y'all to kind of calm down and feel a ton better, right? We can work with the immune system. We can make it different, right? What are the triggers? How do we get rid of them? What are the supplements we need to braid in with this? How do we take those, right? This is why I need you guys, if you guys want to learn more, just hop on, look in my link in my bio. I'll put it, it's in my link in my bio. It says Linktree. And it says, ready to start the shift. And it's just great. All these videos telling you exactly what you need to know, how to diagnose this, what are the triggers, where we start, right? And then it comes with an autoimmune support group that Gwen is in. She's the best. And guys, follow Lupus Chick on TikTok. She's got great lupus information and resources. She's awesome. So follow her. Let's see, what else? What labs can I ask my doctor to suspect autoimmune disease? Okay, your neutrophils are also high. So neutrophils indicate bacteria. So we're thinking about bacteria. We're thinking about strep. We're thinking about staph. We're thinking about tonsils. We're thinking about anything that's kind of like childhood illness type stuff where you're like, you had a sore throat and you had like white patches on your tonsils and things like that. So we're thinking about more bacteria. Now it's not specific, but I want you to do, I'd love for you to do a lymphocyte array, lymphocyte, LYMPHOCYTE, lymphocyte array 1. It's a great lymphocyte array through Quest. That's a great one. You can kind of figure out like, how are my natural killer cells and what's working in my immune system and what's not working. That's a pretty cool test. But for an autoimmune panel, ANA cascade, right? We want to do an ANA cascade. We also want to do Hashimoto's markers, thyroglobulin antibodies, thyroid peroxidase antibodies. If you feel like your joints are red and swollen, you might want to do rheumatoid factor and anti-CCP. This is all in my resources. If you guys are, join up with me and we can really like knock this down. I'm just piling in the resources so that you guys can have all this in one place and like, have resources for labs. Like what should you be getting? Right. I'm super excited for you guys, to just help you feel better. Right. Are peptides okay to take if you have lupus? Yes. Peptides are great. You know, what's really cool about peptides? I'm really liking, if you do peptides, I'm liking thymosin alpha, I'm liking IL-37 and thymosin beta 500. Okay, these are all immune system peptides, and it helps your immune system kind of like work a little better, get your thymus gland working a little bit better, but it helps your immune system. But see, when you have autoimmunity, we don't want to rev up your immune system, like take a bunch of echinacea and rev up your immune system, because otherwise your immune system will attack you. So no, there are herbs that we should not take when we have autoimmunity. Sometimes mushrooms will flare you up. Sometimes golden seal will flare you up. So we have to think about autoimmune neutral things, right? And peptides are great. Okay, sorry, I just lost my thread here. Okay, so I've got someone ANA positive with a speckled pattern. So speckled is a little bit general. We have to know more. If it says ANA, then you're going to look at the number, right? 1 in 80, 1 in 160, 1 in 320, whatever, 1 in thousands, and a pattern. So homogeneous, nucleolar, speckled. Speckled needs more data. We need to gather more data. I'd like to see you do an ANA cascade, and I'd like to see if we can get more tissues tested to see what's showing up. You always have a dry mouth. You might have Sjogren's. Sjogren's is like, it attacks like the salivary glands, the parotid glands, and then the glands that give you like fluid in your eyes. So your eyes can get really dry. Your mouth can get really dry. Okay. So here's someone, ANA positive speckled pattern, another speckled pattern. So speckled pattern, We got to figure out, is it dry mouth or dry eyes? Is it moving toward scleroderma, which is like some thickening in the tissues of the joints? And you can have like some sort of like scarring on your esophagus and difficulty swallowing. And there's all sorts of different things we need to know about it. But I mean, it could even be Hashimoto's. Hashimoto's could have a speckled pattern. So, yeah. So if you are having a negative result, you're not positive ANA, and you still have rash, mouth sores, joints, very tired, there's something happening, right? We have to keep digging. Don't just get gaslit into believing like, well, there's nothing wrong with me. We got to figure it out, right? We got to dig. So someone's positive ANA, 1 in 160 homogeneous, but your autoimmune panel is negative. Could this be something? Yes, it could. Homogeneous, we don't screw with homogeneous. Homogeneous can go to lupus. So we're going to consider, like, here's how I want you to think about it. I want you to think about symptoms. Some basic symptoms are a 1, 2, or a 3. Full-blown lupus is like an 8, 9, or 10. Okay. When you get a homogeneous pattern, you're somewhere in the middle. It's almost like an ombre-like color that kind of fades in. The more you get it, higher your number gets. So you want to take this seriously. You've been given a warning shot. Anybody with ANA positive, I don't care what pattern it is, you've been given a warning shot. And you have to think about, what am I going to do next to try to calm my immune system down? And why is it gotten dysregulated in the first place? So did I get sick? Am I still dealing with an infection? Is there mold? Is there Lyme? Is there, you need to think about maybe doing like an autoimmune paleo diet for a short minute, like maybe for a few weeks, where you just take all the foods out that are like all the grains, the dairy, the nightshades, the nuts and seeds, and you just kind of do meats and veggies for a little while. See how you feel. And then slowly reintroduce foods into your diet. And you might find that you have some big food triggers. It's pretty common. So yes, so we need to think about, this is where I want to put you. I'd love to put you into my little program, my autoimmune shift program. It's like $179 for the whole course. It's amazing. I'm trying to make it kind of inexpensive for you guys. And then it's $50 a month if you want to stay in the course with an autoimmune support group, and I lead it. Gwen's in there, and we have other people that have autoimmunity that are in there, and we have do Q&A and talk about, resources and what we need to do next and what do these things mean. So I just wanted to make a giant resource for you guys. Okay, someone had pain in their toes when walking from a statin. Yeah, it's tricky, isn't it? So what can happen to a lot of people that are taking a statin? Some people take statins and they're fine, and other people take statins and their legs ache, they ache, their feet hurt. You actually are getting muscle destruction from the statin probably. So you can take a coenzyme Q10 that will help, or you can just talk to your doctor and say, I can't take this, I need another resource. So if you need to be on a statin, they might put you on something different. There's some other choices that are a little bit easier on you. So you might want to get off of that. 49, 0 meds, blood pressure started going whack, numbing in hands and elbow and right hip, always hurting and back pain. Wow, all this just kind of came on. Okay, and blood pressure started going high. How's your blood sugar? Are you feeling like your blood sugar is getting too high? Do you feel like you're gaining more weight than usual? I mean, 49, you're going to have, you're in perimenopause or menopause, one of those two, and your blood sugar is going to be whack for sure. So I want you to think about blood sugar. What if you got like a little blood sugar monitor on the back of your arm just to see if that's contributing to some of this? Lingo or Stello has the blood sugar monitors. They're like $50 a piece. Pop them on the back of your arm. They sync to your phone, give you so much data. So think about that. Okay, someone says ANA elevated and my IgG. Oh, sorry, I just kind of lost you there. Hold on. Okay, my IgG was very high. My IgG was normal a year ago. They say it's nothing. Okay, do you have a pattern? Do you know? Is it homogeneous? Is it speckled? Do you know? 1 in 640 is getting kind of high. IgG is very high. So those are immunoglobulins. It's like, tells me about the activity of your immune system. Your immune system's like really active toward maybe you, right? Because autoimmunity is your immune system is attacking your own body, right? So we need to get to the bottom of like, why is this happening, right? My autoimmune shift program, it starts now. Whenever you want to start with it, it starts now. It's like kind of an evergreen program. There's 13 videos that you go through and you learn all the things about autoimmunity that I need you to know before you join the group so that we can all have the same, information and knowledge about it. And then all the resources are there and all the supplement links are there. And we decide what kind of things make sense for you as you go through the program. So it's just great. I'm trying to really get all the people there so I can give you guys all support. It's going to be fun. Don't have an appointment till June. Frustrating, right? Now, it's something you want to think about is, can you get cash labs done through Quest before you go in June? Do you have enough labs, right? Quest is offering some cash things. I can access Quest cash labs too. If you need a slip for ANA markers, I can send you something. Just let me know. It doesn't cost me anything. Just give me your name and your email and I can pop it into FullScript and just send you a link. So anyway, just think about it if you want some more support. Will it help with ITP? And that one usually is with your platelets. So anything that you have that's autoimmune, I don't care what the diagnosis is, I don't care what they call it, it is helped with just all these ways that you can change your immune system, right? So if you want to be on a medication, no problem. We're going to braid in vitamin D and glutathione. We're going to get you on the right diet. We're going to get you sleeping. We're going to figure out your hormones. We're going to figure out all these things that can be triggers, right? Because these are big triggers that can destabilize your immune system. I mean, just going into menopause is a trigger. Losing your estrogen, trigger, because your estrogen is an anti-inflammatory hormone. So yeah, so it will definitely help with that. Okay, high complement C3 means with positive ANA. So complement, let's talk about it. So complement, it tells me there's a C3 and a C4. It gives me your overall pathogen load, what's your immune system dealing with, right? So if you have a high C3, it means your immune system is really active right now and it's really fighting something. Now, is it fighting something or is it fighting you, right? So high is better than crash down low. When you get really, really low complement, it means your immune system's listen, I'm out, I'm exhausted, I'm done, right? And we don't want to get you to get there. So we want to support your immune system so it can do a better job and it can decide, make better decisions about self versus non-self, okay? We need to decide what's foreign and what is my own body. Please stop attacking me. And then sometimes what will happen is most of my patients are pretty sensitive to gluten and dairy when they have autoimmunity, me included. RIP, total rip. It's terrible to not be able to eat gluten and dairy, but also my ANA went down when I got off of gluten and dairy. And I'll tell you why. So gluten and casein, this is not lactose. It has to do with casein, the protein of dairy. Those proteins are so similar to your own body's DNA that it's a cross reactivity. It's it attacks the gluten and casein and also attacks you at the same time. So if we take gluten and dairy out for a little while, we might get your immune system to calm down and you might feel better. So I have so many things to say about this. I'm telling you, you guys got me. I've got so many questions. I'm excited. Thank you. Getting cramps. So is this the statin person getting cramps? I would think about maybe getting off of that and talking to your doctor about something different or really rethinking if you need it. I'm happy to talk with you about that. This is a really, really tricky topic. I don't know. My husband has really high cholesterol and we've done a million things, but you know what's helping him is I have him on a little paleo-ish diet, lower sugar kind of diet, high protein, high veggies, all that stuff. And then also I have him doing a sauna and a cold plunge 4 times a week. It's helping. His numbers are looking better. I don't know. Maybe it's because I just want to torture him a little bit too. That cold plunge, whew, spicy. Okay, so when's ANA positive, 1 in 80 nuclear speckled. Positive dsDNA. Okay, red light, stop. Positive dsDNA can indicate that lupus is coming or lupus is here. Okay, so we stop everything and we think about how can we calm this down because we do not want to go further if we don't have to. So I would love to see you join up and do my course. It's 13 videos. They're not crazy. And then a resource group, a support group, and then a bunch of resources. So you can get supplements, you can get support, you can get a diet change. We need to turn you around. I don't like the dsDNA. I don't like it at all. If we can turn this around, I would love that. That would be my favorite thing. I don't like dsDNA. Okay. And here we've got, here's us. Okay. My friend, Kayla, you got some stuff going on. 160 speckled anti-CCP antibodies, which is highly correlates to rheumatoid arthritis. Okay. There's rheumatoid factor, and then there's anti-CCP. Okay. Anti-CCP is a little bit more rheumatoid arthritis. Salivary proteins, all sorts of bits. I think your joints might not feel good, Kayla. Are your joints hurting? Are you feeling like you have some redness or swelling in your joints? Are they getting a little swollen? Anybody that is popping in with rheumatoid arthritis or those markers, I like putting you on an autoimmune paleo diet, AIP diet for a minute, like just veggies and meats for a little while, and then move into the foods and see how you do, because it can be nightshades, peppers and tomatoes and eggplants. It can be lectins like peas and nuts and seeds. It can be gluten and dairy. It can be soy. I mean, rheumatoid arthritis, you can react to a lot of different foods. So we got to figure that out. So let me know if you need some help. I have a whole video on my autoimmune shift program for rheumatoid arthritis and eating, how you need to eat for that. So, and then somebody has speckled pattern ANA 6 months ago was 1 in 1280. So speckled pattern 1280 is getting up there, right? It's like, it's serious. Your immune system's like, listen, we have autoimmunity. Something's happening. So you probably have symptoms on top of that. So this is kind of like, a long time ago when we used to, I'm 56. So when I was a little kid and they had like an overhead projector and you'd have like a picture and you'd overlap another thing and overlap another thing. And then you had like this thing that your teacher was like, look, there's the chart. Here's the this and here's the that. Anyway, you might not be that old, but this is what I'm trying to do with autoimmunity. It's like overlying things, right? You have your marker, 1 in 1280, it's speckled. That's pretty significant. Overlying that, what are your symptoms, right? And overlying that, then we look at deeper things. How's your vitamin D? What's happening with your blood sugar? Do you have inflammation in your markers in your blood work? Do you also have other markers that are other autoimmune that are specific to each tissue? I'd like to see you get an ANA cascade just to see if there's specific tissues involved, because it's high enough. Now, sometimes you can get an ANA speckled and you can have Hashimoto's. So do thyroglobulin antibodies, thyroid peroxidase antibodies. Now, if you can't get somebody to run these labs, you could probably run all these autoimmune markers for under $200 in cash from Quest. And you might have to have someone order it, message me, DM me and say, this is my name, this is my email, this is what I want. I can send you a link to a supplement. I can send you a link to labs. And then you can just know, right? Okay, IgG was normal and now it's like through the roof. Okay, IgG, immunoglobulin, it tells me how active your immune system is. So your immune system is like really active. It's really doing something. It's doing something hard. Like, are you noticing symptoms? Like if you notice symptoms, we want to, again, overlap that with your labs and go, what do we think this is? Because that's what the rheumatologists are doing. Sometimes labs are very clear and it's kind of a gift. It's like, oh, you have X. Amazing. Let's move forward. But I think a lot of you get really stuck in the weeds on like, I'm ANA positive. I have these symptoms. No one's diagnosing me. No one's helping me figure this out. I feel betrayed. What the heck's happening? And the real truth is that your rheumatologist is like, I don't know what this is yet. We don't know. And that's really frustrating. I know it's really, really exhausting. So I can help you know a little bit more. Sometimes it's just you have autoimmunity. We have to calm it down. That might be all we know. Benlysta, yes or no? It depends. I mean, I don't think that it's a problematic thing to be using if you need to. I mean, with autoimmunity, we want to, if you need some medication to calm your immune system down, do it. The last thing we want to do is be healthcare people that are like really special. Like these, I see a lot of these functional medicine practitioners that are like, don't take medication, just take vitamin D and take turmeric. Well, that's not enough for a lot of people. If you have joint destruction and you have rheumatoid arthritis, guess what? It's going to destroy your joints and you're going to be taking your turmeric and you're going to take your D and you're going to be on the right perfect diet and it's not going to help because the immune system is going too hard. It's almost like you're trying to put out a fire with your little tiny like watering can. And you really need a fire hose, right? So let's do the fire hose if you need it. And also let's braid in some things to make it easier, right? So I'm not on one side or the other. I walk the middle line. Medications are important, but also we have to know why you have this so that we can really figure this out. Does that make sense? So let's see, 80 positive, 1 in 80 nuclear speckled and the positive DNA. Oh, I already did that one. Okay, hold on a second. Let's see. lots of tests here. Okay, here's someone that says ANA 1 in 130 is probably 1 in 120, or 1 in 180 maybe. 60, 80, 1. Yeah, it's usually 1 in 180. All autoimmune panels are negative. Your CRP stays around 14. Okay. Yeah, you have some inflammation. Okay. We should get to the bottom of that. Is it food? Is it Epstein-Barr? We haven't even talked about that. That one's a crazy one. Is it leaky gut? Are you not sleeping? Are you exhausted? What's happening with your blood work? What does your blood work say? I would like to get to the bottom of that. Gwen says, recommends getting a lab and have more support when you go to the doctor. Yes. And we hope we can find a doctor that can support you and run what you need to run. Okay. Let's see what else. I've been tested for lupus 3 times since 2014. Negative ANA, worst lupus symptoms in last year. Yeah, I mean, yeah. Oh, and Kayla says yes to the joint pain. Kayla, we got to figure you out, my friend. I think you're getting rheumatoid arthritis. So, I mean, I'm not here to diagnose you on the internet. I don't even know you, but I'm looking at that lab going, ooh, red flag, stop. We got to figure this out. Okay. Yeah, I'm happy to help you if you want to this is why I made this whole program. So you learn all the things. I don't have to teach you one at a time because there's a lot to know, right? And everybody, one of you has a different autoimmune disease and it's a lot, right? I just want you to know what you're doing. Okay. Yeah. So you know what I would do, Sybil? I love your name, by the way. My front desk person's name is Sybil. She's awesome. So you know what I would do? Oh, there's a couple tests I would do. I would probably do a test through a company called Cyrex, Cyrex. I can always send you a link for it if you want to. It's a blood test and it tells you every single possible tissue that you could have antibodies toward. And it's a very low level. So it picks up low positives. So you might need a test like that to really find it because something's happening. You don't have all those crazy symptoms if something's not happening. What else? Functional medicine. What's the difference between functional medicine and real medicine? So medical doctors and DOs will give you, if you have an autoimmune disease, they'll give you a medication and that's about all. Functional medicine does a little bit more where we're like, okay, here's what we know. Here's what else we know. How are we going to increase your regulatory T cells to calm your immune system down? Vitamin D, sleep, get your immune system settled down. Talking about blood sugar and leaky gut and Epstein-Barr and chronic viral infections. So we dig deeper. There's so much to know. And there's so much to know. We can't really expect every doctor to know all the things. So is NAC safe for mold toxicity? Okay. Yeah. So let's talk about that real quick. So NAC is a precursor for glutathione. So NAC it's a biofilm buster, right? Which is awesome, except for you're about to open up a bunch of biofilms and your body has to be ready to do something with it. So be careful with your NAC. Maybe take one a day for a week and make sure you are okay with it. There's a really cool supplement called GI Detox, which is the same company that makes biocidin. Anyway, if you want to link to something like that, that might be helpful. Bind up some of that mold as you're getting rid of it, as you break the biofilms, might be helpful. Benlysta works for some of us and not for others. Yeah, it depends on your system. Yeah, absolutely. It depends. This is why autoimmunity is it's really particular. Like you just have to a person, right? It's hard to say for sure, right? For everybody, right? This is why it's so tricky. We have to figure it out for you, right? What's good for you. So ANA positive, 1 in 160 with homogeneous, have an appointment with a rheumatologist tomorrow. Ask for an ANA cascade or an ENA panel. Okay, that's going to be helpful. Kappa light chain. Okay, ANA pattern high. This is all autoimmune markers. Okay, so what we need to do more testing and figure out why you're triggered and what that's going to go toward. We need to figure out what's next for you. We need to make sure we're balancing your blood sugar. You need to be on vitamin D. Vitamin D, 5,000 IUs every single day. Okay. Get on that. Lots of things, lots of strategies here. What does cytoplasmic mean? So cytoplasmic can go towards something that's called CREST. CREST, it's acronyms for every single thing. So it's like a calcinosis of the tendons, kind of like you can get some calcium deposits. R is for Raynaud's, right? You have Raynaud's at the ends of your fingers where your fingers get kind of white and cold. Esophageal issues, so difficulty swallowing. It can be a little scarring. Sclerodactyly, which is you're going to have like joint things. This is pretty much like a joint thing where you get real fibrous joints and they get really stiff. So that's something that you want to look for if you have any symptoms. But listen, if you have any of this stuff, we've got to figure out why you got it, what we're going to do about it, right? So if we know you got it from Epstein-Barr, which is what they're finding is really triggery for lupus, then what happened to that Epstein-Barr? Is it still active? Does it get active when you're under stress? Does it get active when you're tired and run down? Do you get lymph nodes swollen and exhaustion when you get overwhelmed? People have chronic Epstein-Barr infections that can flare up. And then we have to give you some antivirals that are herbal with vitamin A and vitamin D to try to calm everything down. Okay, makes sense? So there's lots of things that we need to figure out. I have Hashimoto's. Okay, listen, we can handle Hashimoto's. Come on over. Autoimmune shift. Let's go. Come over to my program. You can learn everything about Hashimoto's, learn about the triggers, how to calm it down. You need to get on selenium. You need to get on vitamin D. You need to get off of gluten and dairy. You'll feel a lot better. We need to get your thyroid to make sure that it's working okay, right? Your immune system is attacking your thyroid. It's not working as well. So do you need to be on a little thyroid medication? Maybe. That's okay. We're not anti-medication here at all. Like we are just like weaving it all together. Okay. We're just going to try to braid it in. What do you do with leaky gut? So it depends. Okay. Sometimes leaky gut comes from food triggers, gluten and dairy issues, and you had H. pylori infection, or you have high stress. Okay. That's a thing. Now, also, you can get an overgrowth of a bad bacteria. If you have a bad bacteria in your gut that's overgrown, it can cause inflammation in the gut lining, and it can cause a really severe leaky gut. When you have a leaky gut, the food is not staying in your gut. It's going straight into your bloodstream and triggering your immune system. We don't like it. It could be the driver of autoimmunity. So if you have it, it's not a problem. We can fix it. We just have to know it's there. This is why sometimes you have to get some testing done. Okay. Oh, and someone who has MS too. Okay. Yes. So MS, I want you to think about, I want you to actually, you know what I would love to do with MS is I would love for you to get a full food allergy panel done by Cyrex, because MS has some specific sensitivities. Let me think if I can come up with the top of my head. Corn, spinach, tomatoes. There's one more. Oh my goodness, am I going to come up with it? I need to have this list in my head a little bit better. I would definitely get off of corn, spinach, and tomatoes. Those are all known triggers that food reacts with, the immune system reacts with the food, cross-reacts and attacks your myelin. Okay, your myelin sheath. So gluten and dairy can be really tricky too. Eggs can be tricky. So we need to kind of do a test and see what you have. Is stage 3 kidney disease bad? Well, it can be if it keeps going, right? You can kind of pull it back too. What are we doing about this? Do you have lupus? Do you need to be on some herbs to protect your kidneys? Do you need to be on, I would put you on glutathione. Glutathione liquid would be a miracle for you right now. Calm down your kidneys. Let's get them to calm down. Get yourself hydrated. If you have lupus, we got it. If you need to be on a medication to calm your immune system down, please be on it. I don't want this immune system to hurt your kidneys. Rheumatoid arthritis and psoriatic arthritis. But I'm worried for lupus. Sure. Kayla, welcome back. Okay. Yeah, of course you have rheumatoid arthritis because psoriatic arthritis. This all makes sense with the positive anti-CCP. So, I want you to learn everything you need to learn about how to use functional medicine to calm your immune system down, because your immune system is on fire right now. It's like, let's attack some more stuff. So why is it doing that? How are we going to calm it down? Okay. So let's think about that. I would love for you to join my autoimmune shift program. I would love that so much because I'd love to support you and help you figure out how to calm this down, because it's not hard. We just have to think about what are the things that are triggering you, right? And it's a bunch of things. Like I made 13 different videos for like each topic that we're dealing with. So, okay. What else? Yeah. I don't know who you are, gal, but I'm going to block you because there's, here's the interesting thing is that there's so many things that we know for sure that help with autoimmunity. We know that. It's interesting. You look at the Nobel Science Prizes for learning about how autoimmunity works. So good. So good. But who's doing what do you do about it? How do you increase your regulatory T cells to calm your immune system down, right? Lots of things you can do. Vitamin D, vitamin A, fix leaky gut, figure out food triggers, figure out what's going on with your viral load, right? And potatoes. Oh, thank you, Gwen. Potatoes. That's more nightshades. But yes, potatoes can be really tricky. How do you know if you have leaky gut? How's your digestion, right? Do you feel like you get bloated and your gut hurts? Do you feel like you get reflux and you're just like, ooh, I eat that and I just don't feel really good? You can get real bad constipation. You can get real bad diarrhea, any of that stuff. Could lupus affect your kidneys? Yes. Okay, your GFR was 84. 84 is a good number for GFR, by the way. But yes, lupus can affect your kidneys. So I want you to think about getting on glutathione. Glutathione is super protective of the tissues of your kidneys. So that would be my number one thing. A liquid one, trisomal glutathione by Apex. I would love to send you a link if you want that. Let me know. Diffuse systemic sclerosis and Raynaud's and fibromyalgia and osteoarthritis. My friend, you have some stuff going on here. What are we doing with this? We need to calm your immune system down. I don't like this. I want to change everything. I want to make sure your blood sugar is steady. I want you to be on vitamin D. I want you to be on vitamin A. I want to check and make sure you don't have leaky gut. I want to make sure you're sleeping. Okay. We really need to make sure you don't have a high viral load or something like that that's triggering you. GAD65. GAD65, I'm super familiar with that. So when you have type 1 diabetes, you can have antibodies toward GAD65. And when you have antibodies toward GAD65, it means that you don't make a lot of GABA in your brain, and it can make you feel really anxious. So people with type 1 diabetes tend to have more anxiety because they have antibodies toward this GAD65 that helps you make GABA. So yes, GAD65, usually there's anxiety, and it can be that your pancreas is really involved. So I would maybe you've gotten tested for type 1 diabetes. I don't know, but definitely do that panel through Quest to make sure you know what you have, right? If we know what we have, amazing, then we can start working on it, right? Let's start braiding in some strategies around this. So we got to figure this out. dsDNA value 7.3, is that positive? Oh my goodness, I don't have my labs in front of me. I'd have to look at the range. I can't remember what the cutoff is for dsDNA. I don't know. I'm sorry. I wish I could help right now. I'd have to look that up. You know what? Get on chat and say, what's the cutoff for dsDNA? It's close. You're close. I saw my rheumatologist on Monday. He ordered many labs, half still pending. My hemoglobin. Your hemoglobin is 6.8. Are you kidding me? Are you okay? That's really, really severely iron anemic. I'm worried about you. Sybil, we got to get you. What's happening? Are you bleeding? What's going on? You need to eat some more meat. We need to get you on iron. Stat. They might give you a blood transfusion if your hemoglobin is 6.8. Okay. Whew. Sybil, you got me worried now. Let me know. Okay. Jazzy, send me in my DMs. Can you just send me give me your name and then just give me your email and tell me what you want, and I'll send you whatever link you want. Labs, supplements, whatever you want. Okay. Okay. I'm going to do a couple more questions and then I got to go because I got to go find some dinner because it's 8:20 here, and I'm at my office and I haven't gone. I'm going to send me a message. Oh, thank you. Carissa, please send me a message. This keeps flying up. So please just send me a message and I'll answer your question. Sorry about that. Polymyositis. Sure. You've got lots of muscle pains, right? And you can get lots of tendinous things and really soreness in your joints in your body. So it's a little like the newest diagnosis from fibromyalgia. They're calling it a little bit more polymyositis. Oh my gosh, you don't have type 1. You developed autoimmune cerebral ataxia. Wow. Okay. That's the cerebellum. Okay. So what are you doing? We need to rein you in, my friend. I would love to help you figure out how to calm this down because I do not want you having cerebral ataxia. Don't like it. Don't like it at all. You're unsteady, you're unstable, you're stumbling, you're falling. I don't like it. So there are some strategies we can use to try to calm that down. But this is autoimmunity. Yeah, we just have to calm your immune system down. Wowza. Okay, you guys have some stuff. I'm so glad you guys hopped on. Okay. Okay, I'm going to do a couple more. So your husband can't stay asleep at night. Your husband has a blood sugar problem. Get yourself a Lingo or a Stello blood sugar monitor, pop on the back of your arm, and you'll notice that he probably spikes at dinner, and then by 2 or 3 in the morning, he's crashing down. And then your body has to go into your liver and pull out stored sugar and dump it into your bloodstream and raise your blood sugar, and it wakes you up because it uses adrenaline to do that. So that's what's happening. It's called nocturnal hypoglycemia. 95% of my patients have that from waking up in the middle of the night. So yeah, have some protein and some fat before bed. Be really careful about eating too many carbs, but he might have prediabetes too. Take a look. ANA positive, high numbers, ENA, chromatin antibodies, Smith RMP is 8.0. Okay, so we're looking for lupus. We're cruising around looking for lupus, Smith RMP. So SM RMP, and I want you to kind of really, ENA is always, and when that starts going positive, we're starting to like cruise into lupus and figure out, do you have that, right? We want to figure that out. I'm glad you're going to see, hopefully you'll see a rheumatologist and we'll get this figured out. Hysterectomy, I felt off since, yes. Okay. Are you on hormone replacement? Hopefully you're on estrogen and progesterone. You need to be on both. Probably a little testosterone, even if you don't have a uterus. Yeah. Oh, you're 35. We got to get your hormones balanced, my friend, because that's really triggery to your immune system too. Okay, so 81 and 80 speckled. Looks like a little bit of early lupus markers potentially. Your C3, C4 normal. That's great. I want you to, I really would love to help you with this. I really want to help you I want to help all of you guys with this. I really want you to come and let me help you. Just look in my bio. There's a link tree. Just hop on there. There's things you can download there. There's like essential labs that you should get. There's, follow me on Facebook and TikTok and blah, blah, all the things. But there's also like join the shift. And if you want to join the shift, it's $179. It's like a whole course. It's great. It's all self-paced. You can do it on your own time. And then on Fridays, we have an autoimmune support group at 11 a.m. Pacific. And then there's also tons of resources, links to supplements. You get 35% off of supplements when you work with me. We just put it all in there. And then you get links to all the resources for the labs and what they mean and diets and how should I go about all of these things. Okay. So I'm worried about some of y'all. Oh my goodness. Okay. Sybil, I need you to go figure out what's going on with your low hemoglobin. You are freaking me out right now. Okay. Yeah. Your dad got diagnosed with polymyositis. Yeah. His body's attacking himself. Of course, this is an autoimmune disease. Get him off of gluten and dairy, make him eat more of a paleo diet, put him on vitamin D. That might help a lot. 5,000 I use every day. Okay. You're welcome, Gwen. So good to see you. Okay. Another thing. No, you still have your ovaries. Okay, good. Michelle, good. But you just got your uterus taken out. Okay. Whew, man, I thought you were taking it all out. That's scary. Okay. So many things I want to talk to you guys about. If you have a supplement that you need to get, if you have labs you need to get, send me a DM in here on TikTok and just say, here's my full name, first and last, and my email. And I'll just send you a link through FullScript. And then you can do with that what you want. If you want to talk to me about it, great. If you just want to have it, that's fine. If you want a supplement link, you can order through there. Easy peasy. It's a discounted rate because who needs to be paying more for supplements? My goodness, they're so expensive, right? But I also, organic USA supplements. Yes, they're supplements that are all through Emerson Ecologics, which is a big vendor for lots of different supplement companies. They have very high ratings on being really high quality. There's nothing from China and there's nothing from India because those are going to be problematic places right now where they're not really testing for heavy metals and such. Sorry. So it's all through FullScript. Great reputable brands, Designs for Health, Apex, Thorn, all the things. So if you want, this is why I don't want you to get your supplements off of Amazon because it makes me worried. I don't know where you get them from. Who sourced this? Who is this that's selling this to you, right? Just be careful, okay? If you need something, if you need supplements, if you need stuff, please reach out, DM me. I'm going to be doing lives every single day. I'm doing lives for 90 days. Okay. So hop back on tomorrow if you want. Oh, what's tomorrow? I'm going to be doing it in the afternoon. Probably about 2:00 Pacific here in California. Okay. And then I'll be doing it Saturday, Sunday. I'm going to be doing it every day. Gwen, you can pop back on. It's going to be great. We're going to be Team Lupus. It's going to be great. Okay, you guys, take good care. DM me questions if you have more questions if I didn't answer you. And all of you guys, take care and be careful. Okay. Talk to you soon.